Welcome back, guys, to our last and final podcast for Real Talk to Heal Woman. Today, we'll be talking about the women's services in the reproductive health industry with Cash, Anna,
Ashley.
Let's get into it. Okay, guys, so firstly, we're going to talk about Planned Parenthood, which I'm sure we all know of. It was founded in 1916 by Margaret Sanger, and that makes it over 100 years old. It's also the largest single provider of reproductive health care in the United States, with over 600 plus healthcare centers nationwide, and it operates in all 50 states and several countries internationally. So they provide all types of things. They provide contraception, STD and STI testing, cancer screening, specifically cervical, testicular, and breast. And they also have pregnancy testing and prenatal referrals and abortion services, which I feel like is what Planned Parenthood is most well known for.
Yeah.
But that's only 4% of their services. And they also have LGBTQ plus healthcare, including like hormone therapy and just like general primary and sex health, which I feel like is very important. They have about 2 million patients per year, and about 75% of the patients are low income. So they have help through things like Medicaid, which I feel like is really good because a lot of people don't have access to these services. They have fees that are reduced for people that are low income, or they might need some additional financial help. It prevents about 579,000 unintended pregnancies per year through contraception. Contraception is extremely important, guys. Use it. And they also perform about 4 million STI tests and treatments annually. And on top of that, they conduct 360,000 breast exams annually. And I'm sure someone you know or a family member has breast cancer. And it's just great for something like this because I know people in my family that have faced it. So I'm just glad that those resources are out there and they're not crazy expensive. And then as I said earlier, only 4% of their services are related to abortion. About 97% of their services are preventative and non-abortion related. This is not just for women, this is all types of people. And through this, contraception has directly been linked to women's ability to pursue education and careers, and then early cancer screenings, which are extremely important, and some people can't even afford them, so God knows what could happen. They've saved countless lives. And then STI treatment prevents long-term health complications and infertility. I wanted to talk about currently what's been going on because we talked about this in our last podcast. We talked about Roe v. Wade, which was overturned in 2022, which made it very difficult to access abortion healthcare, and it's just been so restricted in so many states, which made it even more difficult for Planned Parenthood to function due to it being nonprofit.
Right.
But Title X specifically has been cutting funds for the past years, and it's been forcing some clinics to close, which I feel is really sad because it's less innovative and going into the future. Rather, I feel like we're regressing in some areas. But that's just a little overview on Planned Parenthood. I know you discussed something about that as well.
I think it was really interesting that you mentioned college students because I think that contraceptives and like sexual health is really important for a lot of universities just for sexual health. I wanted to talk about the actual services that Northeastern has on campus. We have a lot more than I realized we did. One of those is open. It's the Office of Prevention and Education on campus, and they have a Frisky Husky program. I don't know, have you guys heard of it?
I remember that at orientation.
I've ordered it from.
You have ordered it?
Really?
Okay, that's awesome because I had no idea it existed. For people who don't know, Frisky Husky is a really cool product on campus because it essentially allows you to buy, and Ashley can attest to this, to buy contraceptives, or you don't even buy it actually. It's a free service. They mail it to you. So I think that's really cool for people who maybe don't have as much flexibility in expenses as well as with their times. This is a great and easy way to get contraceptives. How was your experience with it?
I thought it was really it's very open-minded, so they understand that when you get packages delivered to you, especially regarding sexual health and reproductive products, a lot of people want it to not be known. So it was anonymous. It came in a black baggie. It was very comforting knowing that the stuff I'm ordering isn't announced to the public and that it's private and everything. So that was really nice. And it came with a lot of different products that I personally didn't know existed. And it was really fast shipping too. So it's just really similar to how you get packages on campus. It goes through your mailing service and it comes to you. And it came pretty quickly, so I was pretty happy about that. And the fact that it was free too, and it was like super easy to order.
Yeah.
Like it asks for like sizes and like whatever you want, and I just like asked for all of it. Just like I wanted to see what they had, to be honest.
Yeah.
And it was just really interesting, like seeing all the products that they had that I didn't know existed, and they have like tutorial videos up and everything, and it was just like it was really funny.
Cool.
But
I have a question about that.
Yeah.
Was that through, because I know a lot of people are enrolled in the Northeastern Health Plan. Was that through there, or can you also use your like own personal insurance, or was it just free?
It was literally just free. Like I'm pretty sure I don't have any insurance with the school. And like my insurance is back in California where I'm from, so none of that applies. Like it's literally you just order it on their website. It's like filling out like a Google form almost. Like it's that easy. Yeah.
I think the research I did basically said that if you live on campus property or on campus housing, you get it for free. You can order up to 6 of them across the school year.
Like what kind of things can you order?
Like
just like a
everything.
package.
Oh,
so but you can get 6 of those packages. They come within 7-10 days. So it's cool to hear that you're.
Yeah, I got hella left over.
That's awesome.
Yeah.
That's awesome.
Yeah.
The other thing I just wanted to quickly mention was NU Share. It stands for like sexual health, advocacy, resources, education. They have a website and a link. I'll put all the links below. But they're a really cool organization because they once a month, roughly once a month in Curry, they'll offer like free reproductive products. So those are like latex and non-latex condoms, finger condoms. I didn't know those existed, but they give those out apparently. Yeah, menstrual products as well. And one other really cool thing they did, and I didn't realize this existed. Apparently in Merino, there's like a menstrual like vending machine.
Seriously?
Have you guys seen that?
That's great because I always run out of pads and stuff.
No, literally. Apparently it's a low cost vending machine. We can all find it in Merino.
That's so cool.
Yeah, and NU Share helped get that implemented.
That's really great, especially connecting back to how we talked about the pink tax at some point.
Yeah.
So that's just a nice resource, especially for how college students are mostly broke.
Yes,
so.
exactly. I think that's part of like the reason why we talk about disruptive innovation so much, because a lot of it is low cost and people who aren't able to receive it because they just don't have that flexibility in their cost structure. And I think that that's why these free products are so important. But I think that this stuff should be way more accessible than it is. So it's cool to see that our campus is taking the necessary steps to make it accessible for us.
Yeah, I agree. That's something that's really important, I think, too, especially since we're in college and the fact that this topic is still like very
stigmatized.
Yeah, both of you guys said literally what I was thinking of. And I think that's like something that's really important, especially now. I even think the vending machine should be free. Like,
oh, I agree.
Because they offer free tampons and pads like inside the bathroom.
Yeah.
So I want to know like what's the difference.
Sometimes inconsistent though, isn't it?
Yeah.
Like sometimes those are empty.
Yeah, exactly. Sometimes they're empty, which is like really annoying.
Yeah.
But whenever they're full, it's really nice.
Well, that's why I'm curious to hear about yours, because yours is completely different from what we've talked about.
Yeah,
AI.
Mine is literally completely different. So I researched about how AI has been integrated into different services and how AI is a service itself. Currently, the only thing that's accessible right now is like different chatbots regarding sexual and reproductive health.
Okay.
But 78% is still in development and testing right now. So it's going to launch soon. And something that I wanted to connect back to was Cash. You mentioned how Planned Parenthood offers a lot of different treatments and how they have services for different like cervicular cancer, I think.
They do different cancer screening, cervicular,
like
breast, and testicular.
Yeah, and that was something that stood out to me because when I was doing my research, a lot of the AI products that are coming out are addressing those services as well. So there's a lot of different ways where you can find treatments through different chatbots. There's also ways where AI has been integrated into wearables, so you can track your you can track different
like a Fitbit.
Kind of like a Fitbit, but it's more tailored to sexual and reproductive health, which is really interesting. And
How does that work? Like, what does it track exactly?
there's period tracking on
Mm.
it. Regarding just how AI tracks and does screenings, it does like different surveys, and because it does that, it takes those answers and puts them into different educational platforms as well, so then people can be more educated.
Mhm.
And then additionally, another thing you said was that Planned Parenthood is a nonprofit, which I think is really interesting and very innovational, because the thing with AI is that there is like a little dispute because AI is more accessible towards higher income people. It's not totally accessible just because you would need a phone, you would need some sort of device that
Mhm.
is able to download AI. So because of that, I think like there's a little difference since AI is more tailored to wealthier people versus Planned Parenthood
Mhm.
is tailored towards like people who just want to go just to
Yeah.
get resources.
Yeah, like it could be anyone, but
Yeah.
also it's really accessible for low income
Exactly.
people, which is great. And I feel like people are more, at least since AI is very new, people would lean more towards like this thing that's established for
Yeah,
now.
I agree. That's why I think a lot of the products are still under development and testing, which makes total sense. But I just thought that was really interesting, like
Yeah.
how the two things that we researched were like kind of polar opposites, but share the same goal.
Yeah,
Yeah.
because it's crazy because this is like new, and
Yeah.
Planned Parenthood has been around for over 100 years.
Wow.
And
Yeah.
contraception, we discussed this in the last podcast. I can't remember exactly, but even contraception was hard to get and difficult to get during that time. So it just shows how
Yeah.
all these things connect together, you know, the services along with the policies, along with, you know, the description of all the contraceptions. But yeah.
Yeah. I think that it's really easy for us to get stuck in this loophole of like we're kind of alone in this process as young women.
Mhm.
We don't. I think a lot of us, even at the start of this podcast, I feel like we didn't really have the greatest sense for what was out there, what
Yeah.
innovations are being made in this space, and if us as I think fortunate college students don't know how are lower income, lower accessible students and teenagers, girls, boys supposed to know this as well. So even though I think it can feel really like isolating, I'm really glad we kind of talked about these kinds of things because there really is a lot out there. A lot of these are interconnected. A lot of these are working together. And I think if we just continue with this theme of like standing by each other, researching together, having friends, and also services that are here to support you, I think eventually we'll reach the level of care that women both need and deserve.
Perfectly well said. That was beautiful. Thank you guys for watching.
Bye!